Professor V.K. Malhotra, and it is on social protection in India during the COVID-19 pandemic. Let me give a very quick introduction about the keynote speaker. Professor V.K. Malhotra is presently member secretary, Indian Council of Social Science Research, ICSSR, New Delhi. He has recently edited the book entitled Disaster Management for 2030 Agenda of the SDGs, published by Palgrave, Singapore. And his book entitled Economics of Education has been published by Vikas. He has a number of papers published in well-reputed international and national journals in areas of his interest. In his capacity as member secretary, he is also the governing board of renowned social science research institutes such as IEG, Institute of Economic Growth, very well-known institute in Delhi, Institute for Studies on Industrial Development, and Institute for Social and Economic Change, ISEC, based in Bangalore, India. He has recently been elected Vice President of Science Council of Asia, based in Japan. Professor Malhotra, it is over to you now.
Thank you. I hope I'm audible.
You are audible, yes.
Right. Thank you, Dr. Tudor Silva, and my thanks to the National Academy of Sciences of Sri Lanka for organizing this 3-day program on long-term social impacts of the COVID-19 pandemic. It's a great occasion to discuss all pertinent issues related to the social impact of COVID-19 pandemic. And as very rightly said here, that I'll be concentrating on social protection in India during COVID-19 pandemic. I'll begin. Nitin will play, Dr. Nitin will be playing slides for me, and he can share his screen. All right. So social protection, slide number 2, has been used in various parts of the developed world to maintain a certain living standard and address transient poverty. During the late 19th and early 20th century, both in Germany and Great Britain, welfare systems were established to target the working classes. The United States followed several years later during the Great Depression with emergency relief for those struck the hardest. Since there are a number of slides, I'll be concentrating on the more relevant part of it, which would convey a message for the remaining part as well. Modern social protection has grown to envelop a much broader range of issues and purposes. It is now being used as a policy approach in developing countries to address issues of persistent poverty and target structural causes. Moreover, it is being used to provide protection against extreme contingencies like COVID-19. Despite 6 decades have gone into social protection in one way or the other, about 80% of the population of the world remains without access to adequate social protection cover. Social protection has become a preferred instrument of the Millennium Development Goals, which were later translated into SDGs, while the World Bank promoted social protection as a key component of international poverty reduction strategies. Slide number 3. Social protection in India is largely said to be anti-poverty. The economic growth, along with progressive policies and flagship programs of the government of India, have brought greater focus on improving access to education. And we have an act, Right to Education, skill development, employment, and social protection. There are a large number of promotional measures initiated since 1970s. food and nutrition program under public distribution system, midday meals, integrated child development scheme, housing program for rural areas. And then there are self-employment and wage employment programs. Self-employment programs have been known as Swachh Gramin Swarojgar Yojana, self-help groups, Prime Minister Employment Generation Program, Swachh Shahri Rojgar Yojana. This is one of the most important employment guarantee schemes of the government, which took the form of Mahatma Gandhi National Rural Employment Guarantee Act, popularly known as MGNAREGA, enacted in 2005, and is deemed as one of the largest social protection schemes of the world for securing livelihoods. MGNAREGA provides a legal guarantee for 100 days of employment in every financial year to adult members of any rural household willing to do public work in the form of unskilled manual work at the statutory minimum wage. Of course, apart from direct benefits to the economy, like employment, increased consumption, reduction in poverty, women empowerment, reduction in distress, migration, and financial inclusions are other benefits of this program. In next slide, we can see that how this program over the years that it was enacted in 2005, and we can see that how in 2005 total available funds were just 71 billion rupees, whereas total expenditure was 70.52 billion Indian rupees, and by 2020-21, 1189 billion rupees were available, whereas 1114 billion rupees were spent, and 70 to 75% component of expenditure on MGNAREGA is constituted by wage payment, which explains the wage intensity of the MGNAREGA expenditures. In next scheme of the government, we would see, which is Ayushman Bharat Yojana, we would see how universal coverage of medical facilities or health facilities have been given to the 500 million population. This scheme is known as Pradhan Mantri Jan Arogya Yojana or Ayushman Bharat. Ayushman stands for long live, which aims to provide completely cashless treatment to economically vulnerable and unprivileged sections of the society. The beneficiaries are eligible for free treatment up to rupees 5 lakh in empaneled hospital. This health insurance scheme was launched in 2018 and covers 50 crore or 500 million people. Of approximately 23,000 empaneled hospitals, 9,361 are private, whereas 13,470 are public hospitals, and they have already started providing treatment and worth rupees 25,000 crore, which is 250 billion Indian rupees under the scheme has already happened. As far as COVID pandemic is concerned, existing and special treatment packages were used to provide COVID-related treatment, and these covered testing, medicines, oxygen, diagnostics, and approximately 8.3 lakh COVID patients. They took the services under this scheme during the COVID time. Next, please. This is Swachh Bharat Mission, that is Clean India Mission, which was launched in 2014. It has directly or indirectly helped in fighting against the pandemic. The program aimed at constructing 100 million toilets in rural India in 5 years to reinforce behavior change towards sanitation practices and interventions for safe management of solid and liquid waste areas. It is in alignment with the goal number 6 of Sustainable Development Goal of the UN. And there are 2 ministries and departments of those ministries, Department of Drinking Water and Sanitation under the Ministry of Jal Shakti, and SBM Urban, which is monitored by Ministry of Housing and Urban Affairs. The phase 1 of this program has already been completed and more than 100.68 million toilets have been constructed. The phase number 2 commenced from 2020-21 and it will go up to 24-25, where apart from sanitation, 4,378 urban local bodies are to be added with clean water, which would be piped tap water connections, and 28.6 million households will be provided these tap connections at an expenditure of 2.87 lakh crore or 2.87 billion Indian rupees over the next 5 years. As far as the impact felt during COVID-19 of the Swachh Bharat Mission is concerned, we have noticed this impact with regard to personal hygiene, industrial impact, institutional changes, and also changes in daily life, which include how to stand in queue, get a haircut, how to fly by air, using shared transport, or watching movies also. The way industries came out, FMCG, pharma, liquor, or paint industries, they came out with hand washes, sanitizers, female hygiene products, face masks, etc. in a very short period of time. I think that speaks about how the mindset was prepared to do it all in the smallest possible time. Then we have Pradhan Mantri Mudra Yojana, which was launched in April 2015 as a flagship scheme of the Government of India to fund the unfunded by bringing such enterprises to the formal financial system and extending affordable credit to them. It enables borrowers to borrow for non-farm income generating activities from all public sector banks, regional rural banks, cooperative bank, private sector bank, foreign bank, microfinance institutions, and NBFCs, an amount from rupees 50,000 to rupees 10 lakh. And that's about, it has got different types of schemes to cater to different kind of, let's say, beneficiaries, and approximately 3 to 3.30 trillion, which is lakh crore, are being sanctioned or disbursed under the scheme every year to small entrepreneurs for last 4 to 5 years. India has one of the best public distribution system also, which took shape somewhere in late 60s. Under PDS, the states are required to formulate and implement the arrangements for the identification of eligible beneficiaries for the delivery of food grains in a transparent and accountable manner at the level. The Government of India provides food security through one of the world's largest food-based safety nets, with nearly 67% of the population relying on the targeted public distribution system for availing their monthly entitlement of food grains at highly subsidized price. In 2013, National Food Security Act was enacted, and NFSA comprises the Antyodaya Yojana household and persons belonging to household priority households categories. Here, each member is entitled to 5 kgs of grain per month at a highly subsidized rate of rupees 2 for wheat and rupees 3 for rice. Antyodaya household get 35 kgs per month at the same price, irrespective of their family size. Next, please. Social protection during COVID. As far as that is concerned, so we'll talk about some of the major measures under that. A 22.5 billion INR relief package was announced, which included insurance for the frontline health workers, increase in coverage and entitlement of subsidized food grains, cash transfers for the poor, vulnerable and daily wage earners. In March 2020, as the pandemic spread, the Government of India announced Pradhan Mantri Garib Kalyan Anna Yojana as part of the pro-poor package aimed at easing the hardship faced by the poor due to economic disruptions caused by the pandemic's outbreak. The immediate objective was to ensure that no poor or vulnerable household should suffer from non-availability of food. Apart from regular 35 kg of food grains under NFSA per month per family, additional 5 kg per person free food grains were provided to all beneficiaries every month. And the later three sentences or parts of the slides are about the lifting and the distribution, that about 41 lakh metric ton grains were distributed each month to 74 crore beneficiaries. This is about Pradhan Mantri Jan Dhan Yojana. All these schemes I'm trying to talk about because all these schemes have benefited, they have continued, they were further strengthened to take care of the COVID situation also. So Pradhan Mantri Jan Dhan Yojana, again, is a government scheme launched by the government in 2014 to provide access to financial services such as remittance, credit, insurance, pension, savings, and deposit accounts to the poor and the rural and the needy sections of our society. It was launched to provide financial inclusion, services and products to individuals who do not have access to a bank account. These accounts do not need to maintain a minimum balance, so they are set to be zero balance accounts also. And government schemes such as pensions, insurance, and banking services, they became quite convenient to these account holders. Thus far, 445 million accounts, which is 44.5 crore accounts, maintaining a balance of 1,58,713 crore, have been opened. And more than 50% of that, that is 247.5 million, belong to women. Even during phase one, that is March to June 2020, these accounts increased from 38 crore to 39.83 crore. So relief packages, insurance, direct benefit transfers, and credit facilities have been extended by both central and the state governments through Jan Dhan accounts. This is about Prime Minister Ujjwala Yojana, which is to help women get rid of smoky kitchens in unsafe areas or to move to unsafe areas to collect firewood. And 80 million LPG connections were to be provided to BPL families over a period of 3 years, starting from May 2016. And as a result of this scheme, LPG penetration in Indian household is increased from 55 to 98%. To overcome the economic impact of COVID-19, the government announced a relief package under Pradhan Mantri Garib Kalyan Yojana with various support initiatives for those affected by COVID-19 by supplying 3 free LPG refills to 8 crore Prime Minister Ujjwala Yojana beneficiaries during April-June 2020 across the nation. This is the special employment scheme for migrant workers affected by the lockdown. Government launched Garib Kalyan Rozgar Abhiyan. That is a Poor Welfare Employment Mission, an employment scheme with an outlay of $6.71 billion for migrant workers who returned to their home states during the corona-induced lockdown. The scheme was implemented in a mission mode in 125 days in 116 districts of 6 states, namely Bihar, Madhya Pradesh, Uttar Pradesh, Rajasthan, Jharkhand, and Orissa. It helped to expedite the implementation of 25 public infrastructure works. And the other works that were undertaken included rural housing for the poor, plantation, provision of drinking water through Jal Jeevan Mission, and construction of panchayat bhavans, community toilets, rural mandis, rural roads, cattle sheds, and Anganwadi bhavans. Another important thing which continued there was rural electrification. This scheme was launched in 2014 to provide 24/7 power for all rural areas of India. And today, or by June 2021, the average power supply per day stood at 22.17 hours in rural areas and 23.36 hours in cities. As of March 31st, 2021, all the states have reported 100% electrification of all willing unelectrified households. We know that there is a close link between rural connectivity and growth, employment, education, and healthcare. States with poor connectivity are also the states that reflect poor socioeconomic indices. In 2000, government launched the Pradhan Mantri Gram Sadak Yojana, a central scheme providing funds to states to connect villages to all-weather roads. And on the scheme, more than $10.7 billion on building and upscaling rural roads across the country have been spent. And nearly 200,000 kilometers of new roads have been built across rural areas since 2014. And at an average rate of 109 kilometers of roads constructed per day. So this infrastructure work and rural electrification that have continued during COVID times also. Next three slides are about health infrastructure, COVID cases and deaths, and vaccination program, and how they have finally helped. We'll talk about that in the concluding section. We know we could see the names of these countries, hospital beds per 1,000 population, health expenditure as percentage of GDP, and number of doctors per 1,000 inhabitants. We could see India's statistics and try to compare it with the rest of the world. And health expenditure, 3.54%. Hospital beds per 1,000 are only less than 1 at 0.53. And number of doctors is again less than 1 per 1,000 people, that is 0.93. And we could see that in terms of number of doctors, we can be compared in this table. We have taken a sample of certain countries, advanced and also emerging economies. We could see India and then compare it with South Africa there. And in terms of hospital per bed, I think India's position is not all that good, and so is the case with health expenditure on as percentage of GDP. But when we look at COVID cases and death rate, in next slide, we would notice if we look at the total cases and total cases per million population, we can notice that India's COVID cases were 30,256 per million of population, which is comparable with the remaining countries. And the countries which appear to be close to India include Mexico at 39,000, South Africa 59,000, and Japan, a very advanced country, at 26,000. And when we look at death per million population, then 360 is India's statistics. And just, how far testing in India's case has taken place. The last column gives an idea about that. Of course, it is less than many advanced countries, but when we try to compare it with Argentina, Mexico, South Africa, even in case of Japan, we find that testing per million population was low. So on these yardsticks, India definitely seems to have performed very well, despite the fact its health infrastructure in terms of GDP expenditure, GDP percentage of expenditure, hospital beds, and number of doctors per 1,000 population are concerned. So is the case as far as India's vaccination progress is concerned. In the next slide, we could see that I would invite your attention towards total vaccination per 100. This column where India's statistics reads as 121.173. This statistics is drawn up to 8th February. So it is updated till then only. And we can compare it with US 159, Brazil 166, France 2000, UK 203, but Russia 105, and Turkey 168. We find many emerging countries like South Africa being far below that. Persons vaccinated with 1+ dose per 100 and persons vaccinated with 2 doses also. And finally, we could see persons vaccinated with 2 doses per 100, that is the rate. So 52% of India's population is already covered with 2 doses. And as compared to, we could compare it with Russia, which is at 48%, or South Africa, 29% somewhere. Most of the advanced countries are in the range of 60 to 70% of the coverage, and we are also moving in that direction. So within next 2 to 3 months, most of the eligible population is considered to be vaccinated as far as adult population is concerned. If I talk about, in next slide, social protection measures taken by some prominent countries in terms of economic packages. So we have an idea there. United Nations package was around 11% of their GDP. India's package came at around 10% of India's GDP. UK is around 8%. France again around 8%. Russia was slightly lower as compared to these countries. Italy's package was 480 billion euro. Germans was 346 billion euro. And we could see Japan's 191 trillion yen. And 4.7% of GDP was China's package to fight with COVID-related things. And that included economic measures as well as social protection. In next slide, social protection and COVID-19, we would be talking about some of the major challenges that it offered, has undermined the fundamental importance of social protection as a social, economic, and political stabilizer. It imposed disastrous consequences on the health and livelihoods of billions of people. We know the pandemic and the public policies required to prevent the spread of virus, such as lockdown, virus, and rigorous measures like lockdown, curfews, and travel restrictions, they were introduced, which led to global economic shock also. The resulting shock deprived several millions of people of the opportunity of having a living. Some 8.8% of the global working hours were lost in 2020, which is equivalent to 255 million full-time jobs. Social protection systems have played an important role in reaching vulnerable populations, including through cash transfers and social insurance, and have been instrumental in improving the health and livelihood earning capability of the people who are covered. And this becomes still more important because there was a dire prospect of falling back into poverty, which needed a very strong social protection and support measures. Following social protection, a third phase of the government's COVID-19 strategy comprised of economic support to micro, small, and medium enterprises and their workers to support them through the lockdown period for economic recovery. COVID-19, every effort was made that COVID-19 does not lead to a stark policy choice between lives or livelihoods, as it attempts to forge an approach that protects both lives as well as the livelihood. Economic activity, we know, was brought to a halt as a result of lockdown for 1.3 billion people. Healthcare capacity to deal with this surge was a concern, as there was only 2.3 critical beds per unit of 1 lakh population. The economy was projected to contract by 3.2% in financial year 2020-21, which is 9% point less than the estimates for January 2020. The package that government came out with, it comprised of new social protection interventions and the adaptation to pre-existing benefits, which I was trying to talk about through the initial slides, that what kind of improvisations were done, what additional benefits were extended in the existing program, and how programs were continued along with new social protection interventions. Both anticipation of benefit payments and a top up of INR 2,000 to beneficiaries of PM Kisan, a cash transfer scheme, was done. An increase of rupees 20 in daily wages of workers registered under MGNAREGA was done. Expansion of public distribution system to mitigate the impact of COVID-19 and additional food subsidies to mitigate food insecurity during the pandemic was taken. Additional income support for elderly people, widows, and Divyang, that is people with disabilities, who earn less than INR 15,000 per month and work in companies with less than 100 employees, in which 90% of the employees' wages are below INR 50,000. So financial support for 23 million construction workers from the Building and Construction Workers Fund, with a one-time cash benefit ranging between INR 1,000 and INR 5,000 was provided. Health insurance for healthcare workers was done. Scaling up of Ujjwala, which I was talking about, giving 3 free cylinders to Ujjwala beneficiaries, was undertaken. The pandemic led to severe disruptions in normal life, closing of, as a result of closure of schools, and it impacted over 240 million children of our country who were enrolled in schools. But a multi-pronged approach was adopted. Certain initiatives such as PMMY was initiated to unify all efforts related to digital, online, and on-air education to enable multi-mode access to education. Diksha, One Nation, One Digital Platform, is nation's digital infrastructure to provide quality e-content for the school. Swayam Prabha TV channel, extensive use of radio, community radio, and these things were undertaken. And Samagra Shiksha also was undertaken with the support of states and union territories in the country. As far as stimulus, economic stimulus is concerned, it would give you an idea of the measures in brief. Insurance cover of rupees 50 lakh per health worker was given. 80 crore people given the benefit of 5 kg wheat or rice per person till November 2021. 20 crore women Jan Dhan account holders received rupees 500 per month for next 3 months. Gas cylinders free of cost provided to 8 crore poor families for next 3 months. Increase in MGNAREGA wage rate to the benefit of 15.75 crore families. Ex gratia of rupees 1,000 to 3 crore people, 3 crore poor senior citizens, poor widows, and poor Divyang, physically challenged people. Front-loaded rupees 2,000 paid to farmers under existing PM Kisan to benefit 8.7 crore farmers. Building and Construction Welfare Fund allowed to be used to provide relief to workers. 24% of monthly wages to be credited into the PF accounts, Provident Fund accounts, for next 3 months. For wage earners below rupees 15,000 per month. Limit of collateral-free lending increased from rupees 10 to rupees 20 lakh for women self-help groups, supporting 6.85 crore households. Rupees 3 lakh crore collateral-free automatic loans for businesses, including MSMEs. 3 crore farmers with agriculture loan of rupees 4.22 lakh crore availed the benefit of 3 months loan moratorium. 25 lakh new Kisan credit cards sanctioned with a loan limit of rupees 25,000 crore. Rupees 2 lakh crore concessional credit boost to 2.5 crore farmers through Kisan credit cards. And there was reduction in GST rates on equipment, medicines, masks, and sanitizers, which are being used for treatment of COVID-19. This is how the economy is definitely, I'll take some important statistics from the latest survey, in fact, of the Government of India. A significant increase in capital expenditure on infrastructure to build back medium-term demand was done. And despite the fact that everything was falling, but agriculture still during the pandemic year itself showed a growth of 3.9%. And now we are expecting that in 2021-22, by March 31st, this financial year is expected to end. The consumption is expected to grow by 7% with significant contribution from the government, especially of the form of capital expenditure. Expected growth rate in 22-23 is expected to range between 8 to 8.5%. And survey estimates a growth rate of 7.3% for the year 21-22. After a contraction of, we know, nearly 9%, as I just talked about, most of the macroeconomic and stability fundamentals remain good and strong. Foreign exchange reserve stand at US $634 billion on 31st December 2021, which is equivalent to 13 months merchandise imports and more than the total size of the external debt. BOP, balance of payment, has remained surplus over these 2 years, and there is a strong rebound in government revenues as revenue receipts increased by 67% during April-November 2021 over the same period. Inflation is a major concern all over the world, and this is why the cycles of liquidity withdrawals have been initiated by major central banks. Inflation, we know, is a global issue right now in both advanced as well as emerging economies. But as far as India's management of the situation is concerned, we have been able to manage the situation as consumer price index related inflation stood at 5.6% in December 2021, which is within the targeted tolerance limits, whereas the wholesale price index has been close to double digit, largely due to the global energy prices. I would just like to conclude with these remarks that vaccination has played a key role in last 1 year in opening up the economy, and India has been placed well due to its response strategy, use of safety nets for vulnerable sections, agile approach through updation of information, use of high frequency indicators in uncertain environment, and introduction of supply side reforms in place of mere demand side management, such as deregulation of numerous sectors, simplification of processes, privatization, production linked incentives. And sharp rise, as I said, in capital expenditure can definitely be seen as demand as well as supply enhancing response. As I said in the beginning, before I say thanks, from Jaan hai, Jahan hai, that is life is preferable over livelihood, we transition to Jaan bhi and Jahan bhi, that is life and livelihood are equally important, which reflects the needed effective and timely measures were taken following the three-pronged strategy to deal with COVID-19 by the government of India. And due to this, the society and economy could witness resilience. Then there are few appreciations from IMF, WHO, and UN Chief Antonio Guterres. With these words, I would thank you all for your very patient listening and giving me an opportunity to join with you on long-term social impact of COVID-19 pandemic through my presentation on social protection in India during COVID-19 pandemic. My special thanks go to Professor Priyan Dias, who has taken all these efforts to contact the speakers from all over the world and has definitely encouraged them to prepare the best possible presentations and make their cases in the best possible ways. Thank you very much.
Thank you, Professor Malhotra. I think you gave a very comprehensive overview of social protection measures in place in India in the wake of the pandemic. And what you said is, for the most part, Indian government tried to utilize existing social protection measures to cover new issues, that came up with the pandemic. We don't have a lot of time for discussion because we have we have exceeded a little bit of the allocated time. I think we have about 5 minutes time for discussion, and I will start with question raised in Q&A, and I thought it is from Professor Nadira Karunavira. Nadira, you can ask that question directly. Nadira, are you with us?
Yes, thank you, Professor Tudor. It was impressive to listen to the social assistance programs in India, and thank you for sharing the details. My question is, I'm sure that these programs may have been evaluated before and after. So in your opinion and based on evidence, which one do you think is the most effective, or at least the few that are the most effective on top of the list?
Which is strategy I think you intend to ask, that how it could work, right?
Yes, the effectiveness on, because it is meant to target a certain population, I'm sure, right?
Right. I think, as I said, our response system, understanding of the situation, and taking a timely action, and especially I would appreciate that the committed expenditure on infrastructure and capital items did not stop. As a result of that, as soon as we were coming into the phases that the COVID was in a particular phase or wave, it was towards a receding end. India was definitely rebounding back. There were numerous discussions on what kind of recovery shall we finally witness, and we can see it in a very objective manner also, that we could finally witness a V-shaped recovery model also, which was very quick to response. And this could happen. I said that supply side management, continuity of risk, let's say our reform agenda, which has been drawn for a pretty long period of time, and all social protection measures, every policy was in fact an addition, every new intervention was an addition to an existing scheme and policy. So that added value to the existing policy. We were not going away from what existed in the past. We were adding further things, further interventions, and we were improvising in the given situation. And that is what resulted in the success.
Thank you.
Thank you. Priyan, did you have a comment or question? I just saw, but I can't retrieve it.
Yeah, what I wanted to ask, thank you, Professor Malhotra, for your presentation. It's nice to see you in person and exchange these kind of comments with you. So the previous speaker said that inequality had increased in the UK as a result of COVID, right? Now, I think you gave an impressive list of various social protection measures in India. But in spite of that, is there evidence that inequality has increased? And is there, what would your response to that? And what is India's response if in fact this inequality has increased?
Well, in the immediate circumstances, it may definitely appear to be the case. But what happens after, let's say, a lapse of some time, I think that's very, very important. If I talk about inequality in general in India, our, let's say, Gini coefficient has remained nearly stagnant for several years. And that is true in case of most of the economies of the world. So a period of 1 month, 2 months, 3 months may be significant for those who are suffering at that point of time. But for the evaluation of the economies, we would definitely need at least a medium-term analysis of inequalities also. So what I feel is that at least if there were people who were losing their livelihoods, they were given some kind of support. So immediately it might have appeared, but in the course of time, it has been very well taken care of.
Thank you, Professor Malhotra. And finally, one quick question from my side as well. Now, most of the programs you introduce are state programs, right? State interventions. My question is, what about the non-state actors? Did they play any role at all in pandemic response? Or also the policy environment, was it conducive for non-state actors to play a role, positive role in pandemic response?
Professor Silva, every state intervention can be successful only if there are non-state actors also, non-state participation from the side of all stakeholders. So community in India has responded very well, since the time was a big constraint. So we may not have covered all those things. And every scheme, in fact, has to be supported not only by, has not only to be planned or formulated by the government or policymakers, it has to be down the line implemented by the effective administration, and finally it has to be accepted by public and community. So non-state actors, private sector, they have all helped in these circumstances, but I think that would need separate allocation of time to discuss those issues separately in detail.
Thank you, Professor Malhotra. I think we have a 5 minutes break now. So let's have that break. And then we will, when we come back, we will have 2 lead speakers to talk to us. Also, let me remind all the participants that please use Q&A or chat to ask questions from the presenters. Thank you very much.
Thank you.